Welcome, everyone. Welcome to the Yale School of Nursing Bellos Lecture. I am very, very honored to introduce our speaker for today. It gives me absolutely enormous pleasure to introduce Dr. Margaret Hamburg as the 2018 Sybil Palmer Bellos Lecture speaker. Dr. Hamburg has a wealth of experience in both public health and medicine and is a world-renowned leader and advocate in those areas and others. And just talk about leadership. Listen to her CV. She served as the 21st Commissioner of Food and Drugs Administration. She was only the second woman ever to head that agency. Under her almost 6 years of leadership there, Dr. Hamburg oversaw the modernization of a food safety system to reduce foodborne illness, the advancement of biomedical innovation through the approval of novel medical products in cutting-edge areas of science and medicine, the securing of a safer globalized food and medical product supply chain, and the implementation of the Family Smoking Prevention and Tobacco Control Act to reduce the death and disease caused by tobacco. Prior to her time at the FDA, Dr. Hamburg was a founding member of the Nuclear Threat Initiative, a foundation dedicated to reducing the threat to public safety from nuclear, chemical, and biological weapons. As the Foundation's Vice President for Biological Programs, she advocated for broad reforms to confront the dangers of modern bioterrorism, as well as the threats of naturally occurring infectious diseases, such as pandemic flu. And sadly, this work is still all too relevant. Dr. Hamburg's previous government positions include Assistant Secretary for Planning and Evaluation at the U.S. Department of Health and Human Services, Health Commissioner for the City of New York, and Assistant Director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health. Dr. Hamburg currently serves as Foreign Secretary of the National Academy of Medicine, where she is the Senior Advisor on International Matters and the liaison with other academies of medicine around the world. And if I'm right, Peggy, I believe you're the only mother, father, daughter member of the National Academy of Medicine. Is that correct?
Yeah.
Isn't that fabulous? Additionally, she's President-elect of the American Association for the Advancement of Science, the world's largest multidisciplinary scientific society and a leading publisher of cutting-edge research through its Science family of journals. Furthermore, Dr. Hamburg sits on the boards of the Commonwealth Fund, the Simons Foundation, the Urban Institute, the Global Alliance for Vaccines and Immunization, the Parker Institute for Cancer Immunotherapy, and the American Museum of Natural History. She's chair of the Joint Coordinating Group for the Coalition for Epidemic Preparedness and Innovation, and a member of the Harvard University Global Advisory Council, the Global Health Scientific Advisory Committee for the Gates Foundation, the Harvard Medical School Board of Fellows, and the World Dementia Council. Are you tired yet? I think you should be just from listening to that. Dr. Hamburg hails from a family background in medicine. Her parents are both physicians and leaders in their field of mental health. And, nice story, they met at Yale School of Medicine. Her mother, Beatrix, is a notable American psychiatrist and the first African-American woman to graduate from Vassar College, now led, of course, by our own Betsy Bradley, who was last year's Bellos Lecturer, and the Yale School of Medicine. Dr. Hamburg is an alumna of Radcliffe College, Harvard Medical School, and is the recipient, of course, of multiple honorary degrees and numerous awards. It goes without saying, Dr. Hamburg has truly led a distinguished career, and we're thrilled to have her here today. Please join me in welcoming her.
Well, thank you so much for that very generous introduction, and thank you for inviting me to join you here today. It really is a pleasure to be here to honor the memory of Sybil Palmer Bellos, for whom this lecture is named, to honor the much esteemed Yale School of Nursing, and also to really take a moment to reflect on the really great tradition and future of nursing as a profession. As was noted, I do have some Yale connections. I like to come to Yale. I've never studied or worked here, but I have been involved. First of all, you noted that my mother was the first African-American to go to Vassar. She was actually the first African-American woman to come to Yale Medical School. So that also is another pioneering connection to the school. My parents met here. And maybe most significantly, my daughter was an undergraduate here, and she's now a first year at Yale Law School. So I was just saying it's pretty easy to get me to come to Yale. But that isn't why I'm here. I'm really here because of the importance of nursing, the extraordinary leadership of Dean Kurth, And I think the opportunities to really talk about nursing in the modern world, and to reflect a bit on where nursing has been and also where nursing can go. And importantly, this is really a school with a long and remarkable tradition. I didn't actually understand about this campus. I was going to walk from the study, and Anne very generously offered to have me be met. And I thought, well, that's sort of overkill. But when I learned that it was actually 5 miles and crossing some major highways, I was glad to have the ride. But I kind of like this setting. I mean, both it's beautiful and sort of serene and contemplative in many ways, but also the symbolism of a research campus where there's bench research going on and opportunities to think about discovery, but also the importance of the School of Nursing as the crucible through which both additional research is done, but also it's translated out to the people and communities in need. I was very struck as I was preparing for this speech about the history of this school, really beginning with your first dean, who I understand is often referred to as the mother of nursing education, Annie Warburton Goodrich. And I think her vision was really very true and just as relevant today as it was then, emphasizing the importance of social justice and community integration within the curriculum, and a goal to educate future nurses to be scientifically informed, technically expert, and socially experienced. But in many ways, her approach really built on an even older foundation of the nursing profession, the tradition of caring as well as curing, a framework of vital importance, I think, when we look to the challenges before us today, and also as we reflect on some of the greatest medical and public health challenges of the past. Anne mentioned my involvement with infectious disease threats, and some of you may know that this year marks the 100th anniversary of one of the most devastating health threats in human history, the Great Flu Pandemic of 1918. In just 11 months, a wave of death crashed around the globe, killing somewhere between 50 to 100 million individuals. 1/3 of humanity was infected, and those in the prime of life were actually the most at risk because they mounted a very robust immune response. But it wasn't just the magnitude of the pandemic, it was also the ferocity. Many sickened and died in a single day, drowning as their lungs filled with fluid or turning blue and coughing so violently that it actually ruptured their abdominal muscles. Here at Yale, interestingly, the university placed itself under a virtual quarantine, I understand. It passed out gauze masks and tried to isolate students and faculty from the growing threat outside Phelps Gate. The strategy seemed to work. I don't know, but amazingly, Yale reportedly lost only 3 students to the pandemic. But beyond the Gothic walls of Yale, nearly 800 residents of New Haven died. As the pandemic raged, society began to crumble in every stricken community. There was no vaccination, no treatment, no cure. But there was one small spark of hope. As Wilmer Cruson, director of the Department of Public Health and Charities in Philadelphia, which was actually the city hardest hit by the pandemic, declared, if you would ask me 3 things Philadelphia most needs to conquer the epidemic, I would tell you nurses, and yet more nurses. He was right. And research by Dr. Arlene Keeling of the University of Virginia, who studied the history of nursing in the 1918 pandemic, wrote in the journal Public Health Reports that excellent nursing care was the primary treatment for influenza during the pandemic. In fact, whether at overcrowded hospitals or emergency aid stations, in teeming city tenements, or isolated frontier cabins, for the ill, their families, their neighbors, the communities, good nursing care was the single best predictor of outcome. In 1918, nurses were the essential element in combating an unprecedented global health challenge. Specifically, it was the tradition of professional nursing that made the difference. the tradition of combining knowledge, practical skill, and patient-centered values, the tradition of concern for the whole person, their environment, their community, and an understanding of their interconnection, the tradition of not just treating a disease, but of truly caring for a patient or a population. This, I think, was also very much the tradition of Sybil Palmer Bellos, who worked with immigrant families in New York and for whom this lecture is named. And it's precisely this tradition, combined with Dean Goodrich's goal that nurses be scientifically informed, technically expert, and socially experienced, that will allow today's nurses to meet some of the most important health challenges now before us. And this afternoon, I want to talk about three of those challenges: combating disease, creating greater health equity, and caring for the planet. I also want to discuss the role that nurses continue to play in addressing these challenges, whether working at the patient bedside, in the halls of academia, or the streets of a community. And finally, I want to offer a call to action that must be answered if we want to advance and promote the tradition of nursing for the betterment of all. Our first challenge is to combat disease, and that includes communicable or infectious disease, non-communicable or chronic disease, and what some have called communicated disease. So let me first start with communicable. There was a time, which didn't seem so long ago, when we thought that we might actually be removing communicable or infectious disease from the headlines and consigning it to the history books. And believe it or not, as a first-year student at Harvard Medical School, maybe this wasn't true at Yale, but I actually did hear that, or at least that the future of medicine was really going to be chronic disease. The advent of antibiotics and vaccines that were effective obviously gave us great hope, and there certainly has been real progress made. Smallpox, once a devastating disease around the globe, has been eradicated. Polio seems close to elimination. Certainly we've seen serious childhood killers like measles and diphtheria become rare events in this country and in many others as well, although not entirely forgotten, sadly. But we've also seen serious infectious disease threats persist, resurge, and new ones emerge. Truthfully, it was watching the HIV/AIDS epidemic emerge as a medical student that made me decide to pursue a career in health policy and public service rather than the academic career that I had always planned. And the threat of terrorism, which declared itself as a serious domestic concern here in the U.S. really back in 1993 when the first bombing of the World Trade Center in New York City occurred, and I was then health commissioner, that made me start to think about microbes not just as agents of illness and disease, but also as potential agents of war and terror. Today, we recognize that the spectrum of infectious disease is ever expanding, with new, previously unknown diseases appearing and taking hold, as well as the reemergence of old diseases, sometimes in new and more dangerous forms, thanks to inappropriate antibiotic use in many cases, and also to other pressures. And the fact is that even with all of the miracles of modern medicine, we don't always have the antibiotics and vaccines that we need. We know that we live in an increasingly globalized world with very porous borders. With travel and trade, we're increasingly interconnected. A disease anywhere can be a disease everywhere. And changing patterns of agriculture, urbanization, and of course climate change and environmental degradation are all increasing risks for infectious disease. We also know that a pandemic flu like that of 1918 can and most likely will happen again. Influenza pandemics have regularly swept the world about once in a generation. And that's why we were all so alarmed back in 2009, if you remember, when a swine flu outbreak, H1N1, emerged in Mexico. It ultimately caused some 17,000 deaths worldwide, but it was much less virulent than originally feared. And some of us were plenty worried this past flu season when the flu unfolded in a form that was much more vicious and much more lethal than we had expected. But of course, it's about much more than just flu. The next pandemic may be an outbreak of an emerging infectious disease, or a malicious attack using a microbe, or an inadvertent laboratory outbreak, or the reemergence of any number of old adversaries, such as antibiotic-resistant tuberculosis. And that was my first exposure to that set of issues when I was health commissioner in New York City. When I took office in the early 1990s, the number of patients with tuberculosis had more than tripled, and we had a huge, unexpected percentage of cases with drug-resistant tuberculosis. In response, we designed one of the most comprehensive tuberculosis control programs ever, focusing on both prevention and treatment and working well beyond the confines of hospitals and clinics to reach patients wherever they were. And with this approach, we were eventually able to both meet and beat this serious unfolding threat. When it comes to fighting infectious disease, the key, as we saw in New York, is ensuring a comprehensive continuum of disease prevention, diagnosis, response, and management. We must not be afraid, but we must be aware, and we must be prepared. And we must work as partners across traditional boundaries of professional disciplines, sectors, and even borders. And of course, nurses are a vital part of the comprehensive work to fight infectious disease. This was certainly true in our fight to control TB in New York City. Working on healthcare teams, they provided unique understanding of healthcare delivery, necessary resources, infection, prevention, management, and control, and in the best tradition of nursing, the very human and holistic needs of patients that we simply could not overlook. And when it really gets tough, it's often the nurses who are in the lead. I saw that in New York City, and as noted, it was a hallmark of the 1918 pandemic flu. We saw it again when the world witnessed one of our many wake-up calls about the threat of infectious disease in our modern world, the unexpected emergence and spread of severe acute respiratory syndrome, or SARS. That outbreak declared itself powerfully in Hong Kong back in 2003, and the nursing profession was widely noted to have played really an extraordinary role. Public health nurses went into communities and traced contacts, provided education to the public, obtained samples, took health histories, allayed fears, and addressed the depression that was actually a striking concomitant of the SARS disease, and served on research teams in related case control studies and participated in investigation and surveillance. They really helped care both for patients and for entire populations. SARS would eventually spread, most notably to Canada, where it really took an unexpectedly heavy toll and, of course, demonstrated vividly that infectious disease recognizes no boundaries or borders. But as we think about threats to health in the modern era, we must recognize that it's not only communicable infectious disease that can transcend borders, and where meaningful solutions require us to think and act in more comprehensive ways. I want to mention Dr. Gro Brundtland, who was the Director General of the World Health Organization during the SARS outbreak, and she later put in place a comprehensive system called the International Health Regulations to strengthen systems for infectious disease prevention and control. But she was also deeply concerned about another class of disease that she liked to call communicated disease, and sadly, she was really prescient. By communicated disease, she was referring to the large and growing burden of disease associated with so-called lifestyle issues or behavioral risk factors, including smoking, poor nutrition, and lack of exercise. In many ways, these are transmitted or communicated across communities and across nations through marketing and advertising for unhealthy products such as junk food, sugary beverages, and cigarettes. They are transcending boundaries because of how culture spreads through the media, TV, movies, etc., and because the increasingly global nature of our lives. And these health problems, really a subset of chronic disease, are very much global problems. Diabetes, for example, is a leading cause of death and disability in this country and around the world. And unfortunately, the rates of diabetes, particularly type 2 diabetes, are rising very significantly. We know that diabetes is a complex chronic disease that's closely tied to conditions of overweight and obesity. And an article in Lancet last year warned that rising levels of increasingly severe obesity means that worldwide populations are on the brink of a catastrophic epidemic of diabetes. And we're all too familiar with its devastating complications and the significant toll that it takes on the lives of individuals, families, and our healthcare systems. And as with other so-called communicated diseases, effectively combating diabetes relies on treating disease and managing symptoms, but also on addressing both behavioral risk factors and socioeconomic determinants of health. And once again, nurses, drawing on their tradition of caring and curing, are key in prevention and treatment efforts. Certainly, a disease like diabetes illustrates the value and often central importance of nurses across the whole spectrum. They're central to the medical care of patients, acute care, along with more routine clinical management of symptoms and complications. But it's also the occupational health nurses, public health nurses, and school nurses who may be the primary providers of patient education, coaching about self-care strategies, direction, advice, and often most important, support. And unlike their physician colleagues, I will admit, I think it's fair to say that nurses are much more likely to recognize and address the socioeconomic factors that can so affect a person's health. We're increasingly aware that the context of people's lives determines their health as much as genetics and other intrinsic biology. Factors such as physical environment, including safe water, clean air, and healthy workplaces, homes, and communities, income level, educational opportunities, social support services and networks, access to health services and nutritious food, transportation options, and cultural sensitivities are all very significant determinants of health of individuals and of communities. And I know that Betsy Bradley, who gave last year's lecture, addressed some of these issues when she spoke to you last year, and I'm sure that she underscored that those in the nursing profession, using their unique education and skills, their tradition, values, and approach, are among the most qualified to help us all rethink our framework in terms of how to best address health and to better address and integrate this vital reality. It's not a coincidence that so many care managers in primary care practices are nurses, and why they're essential partners in public health and community development efforts to create a culture of health and well-being in patients' daily lives. And this is why, in a setting like this one, academic nursing can play a formative role in undertaking the research and training which must transcend the traditional boundaries of medical care to better prepare us to meet the challenges we face, and in preparing the cadre of new leaders and practitioners that we so need for the future. These, of course, are not trivial things and can have a profound effect on a patient facing a range of diseases, and will become even more important as our population ages across all ages, as well as we see the burden of chronic disease increase. And that burden is high. In the U.S., we know that 7 of the top causes of death are chronic diseases, with about half of all American adults having at least one chronic condition, and 1 in 4 adults with 2 or more chronic health conditions. And approximately 71% of all U.S. healthcare spending is on people with multiple chronic conditions. And globally, chronic disease accounts for 70% of all deaths, or some 40 million people each year. And of that, many of those chronic disease deaths, particularly the ones occurring in the age group of about 30 to 69, are occurring in low and middle-income countries. We tend to think of infectious disease as the source of more burden in those countries, chronic disease a problem of developed countries like ours, but in fact chronic disease really is a predominant threat around the world today, and it's a threat we can only address if we adopt novel and innovative policies, programs, and interventions. And not surprisingly, around the world, we're seeing nurses come forward with innovative programs, many of which address chronic disease outside of clinic walls with improved patient care, satisfaction, and lower costs. One program that I learned about only recently, but some of you may be more familiar about it, is called Berts Org, meaning neighborhood care, and it actually developed in the Netherlands with a nurse-led holistic approach. And I just want to mention it quickly because I think it's important to understand some of the elements that have made it successful. It began actually back in 2006 when a district nurse, Joost de Blok, became frustrated with a model of home care that was very fragmented, that had multiple caregivers doing discrete tasks, being paid by the task and by the hour, not serving patients well, and not being very efficient either. So he created a system where nurses could work in teams caring for everyone in a given neighborhood, directly responsive and accountable to local patients and families, and providing comprehensive medical care and support services that cut across traditional boundaries of work and disciplines. And this patient-centered care, really in the best tradition of nursing, was driven by patients' needs and wishes and by the knowledge of the nurses who cared for them. And it turns out that compared to other home care organizations and programs in the Netherlands, Berts Org has achieved better outcomes, better health, and the highest rates of satisfaction from patients anywhere in the Netherlands, and it's saving money. And I think the elements that make it successful go back to this application of the nurse's own knowledge, practical skills, and experience, working in interdisciplinary ways, breaking down barriers that interfered with care and with health, and establishing real trust between the patient and the healthcare providers. And, again, this goes back to the traditions of nursing, really the crux of the nursing tradition, and I think nicely sums up the importance of nurses to combating disease, whatever its complexity and whatever its cause. And of course, the tradition of nursing is also a prescription for so much that ails our healthcare system, beyond just combating disease. One of those ailments is inequity in health. Creating greater health equity and eliminating health disparities is another of the big challenges that I want to discuss with you today. It's sobering to look at some of the statistics. From a global perspective, according to the WHO last year, a child born in Sierra Leone can expect to live for 50 years, while a child in Japan can live to 84. 87% of premature deaths due to chronic disease occur in low and middle-income countries. And developing countries account for, I'm told, 99% of annual maternal deaths around the world, although that struck me as a little high. But I know that this is an area of particular interest to Yale, especially given the incredible depth of midwifery expertise that's on your faculty and in your training and research programs. But I want to stress that inequalities are often just as stark within countries. In the U.S., for example, African Americans represent only about 3% of the population, but account for 50% of all new HIV infections. And sometimes geography is destiny even within a city. In London, when traveling east from Westminster, each tube stop represents nearly 1 year of lost life expectancy, according to the London Health Observatory. So a few miles apart on the Underground may be miles apart in terms of health and longevity. And here in the U.S., a series of maps that were developed by the Center on Society and Health at Virginia Commonwealth University, a project funded by the RWJ Foundation back in 2016, show that life expectancy can differ by as much as 20 years in neighborhoods only about 5 miles apart from one another. Really quite extraordinary, but not a surprise. Certainly when I was health commissioner in New York City in the 1990s, I too observed that there were great gaps between neighborhoods with the worst rates of infant mortality, HIV, TB, and more, all layering one on top of the other in some of our poorest communities. So if we truly don't want communities, cities, even the global community divided by separate but unequal parts, then I believe we really must work together to address this huge concern. First, we must do more to prevent disease in underserved communities. That includes effectively reaching out and getting the right information to the right people in the right way, and increasing scientific research that explores risk factors in these communities. We must enable access to health care by removing physical, social, legislative, cultural, and especially financial barriers. And we must ensure culturally sensitive care, which also means communicating across divides of race, social class, education, and attitudes. Of course, to achieve these things, to create greater equity in health, it's once again nurses that are so very often on the front lines. Nurses and midwives account for more than 50% of the global health workforce. And in the developing world, they're often the only health provider that someone may see. Additionally, as I've just noted, nurses working in the community are best able to assess the many factors that may hinder health, to engage community strengths, and to ensure culturally sensitive care. And whether it's locally or globally, it's nurses who are often the catalysts and change agents in reducing health inequality. And as we work to achieve health equity, we have another task before us, perhaps one of even greater long-term dimension and proportion. And this is the third big challenge that I want to discuss: caring for the planet by advancing planetary health. And I know that this is an area of focus and activity that Dean Kurth has been deeply committed to. And if we care about the future, I think that all of us must engage. It was in 1993 that Norwegian physician Per Fugelli raised an important alarm about planetary health when he wrote that the patient Earth is sick. Global environmental disruptions can have serious consequences for human health. 21 years later, a commentary in the March 2014 issue of Lancet called for the creation of a movement for planetary health. And they then joined the Rockefeller Foundation in a commission which in 2015 released a seminal report with a rather obscure title, Safeguarding Human Health in the Anthropocene Epoch. The report explored the scientific basis for creating planetary health as a new field, and I found it quite compelling. As you may know, this new field goes beyond our current global health framework to take into account the natural systems on which human health depends. It formally recognizes the link between human-caused destruction of Earth's ecosystems and the resulting impacts on public health. And above all, it holds that to protect the health of people, populations here and around the world, we must fundamentally address the health of the biosphere. And in my view, if we overlook the need for a planetary health movement, we will do so at our peril. It's true that global achievements in health, agriculture, and industry have ensured that we're living longer and better lives in many ways. Although, as I just noted, grave disparities continue to exist. But unfortunately, we also know that our tremendous socioeconomic progress has taken a toll on the life of our planet. We need only look quickly at some of the evidence. The climate is warming. Almost half of all tropical forests and a fifth of all coral reefs have been lost. Thanks to fertilizer runoff, the Gulf of Mexico's dead zone is now twice the size of the Chesapeake Bay, and 2/3 of the world may face water shortages by 2025. And I have found it sort of startling to read about the problems in Cape Town, South Africa today, where they may run out of water by next year. So in the end, this matters for all of us, our health, our safety, our well-being, and ultimately our lives. Any complacency that we feel about planetary health, I think, should be replaced with a sense of urgency. And in particular, the Landsat Report outlines 3 tasks for the global community. First, to address conceptual and empathy failures, such as an over-reliance on GDP as a measure of human progress. We must address knowledge failures, such as historical scarcity of transdisciplinary research and funding. And third, implementation failures, such as the failure of governments and institutions to recognize and respond to threats in a timely fashion, or to ignore scientific fact in favor of political expediency. And I know that Yale is already working to tackle many of these issues and all of the embedded complexities as part of the Planetary Health Alliance, which is a consortium of over 95 universities, NGOs, government entities, and other global organizations funded by the Rockefeller Foundation and dedicated to advancing planetary health. And I think that the Alliance will clearly benefit greatly from all of the assets of Yale University across its many schools and experts, its depth in health, science, policy, and management. So caring for the planet, creating greater health equity, combating disease, there is a lot to be done. But mobilizing the talent, training, and commitment of the nursing profession will be vital to meeting all these challenges. And I don't think I need to tell you that this is a critical time for nursing. To improve health around all these issues and so many levels, we must work to strengthen nursing and to ensure its proper role. And I know that many of you in the room are much more deeply involved with these issues than I, but let me offer quickly a few thoughts before I close. First, I'm struck, maybe this is because I work part-time at the National Academy of Medicine, what used to be the Institute of Medicine, but we must continue to pursue the recommendations of the landmark Institute of Medicine report. Second, we must strengthen and extend the global nursing workforce. And third, in the immortal words of Rodney Dangerfield, we must always ensure that nurses in every field and of every capacity receive the respect they deserve. So let me just quickly, briefly elaborate on some of these points. I'll begin with the IOM report, written back in 2010, almost a decade ago, and mainly aimed at U.S. nurses, but I think that its recommendations are relevant for the global nursing concern, and they're also still extremely timely. There's also, I think, merit in sort of looking at what progress has been made. That report had 4 key messages: that nurses should practice to the full extent of their education and training, that nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. This is one probably of particular relevance to the community here at Yale. As I understand it, this was actually the first School of Nursing within a university and with a degree that actually met the standards of the university. And I think this really began a tradition of cutting-edge improvement and constant advancement in nursing education, really emanating here from Yale. The IOM's third message in the report was that nurses should be full partners with physicians and other healthcare professionals in redesigning our whole system of healthcare in the United States. And fourth, that effective workforce planning and policy making requires better data collection and an improved information infrastructure. So these were all good recommendations, but the question is, have they made a difference? Have they been acted on? What remains to be done, and what new concerns or perspectives have emerged? I think we all know that too many good reports just sit on shelves, and I was glad that a few years ago the IOM actually convened a committee to assess progress, and encouragingly, there were some striking accomplishments. In the interest of time, I think I won't go through those, but to say that in each of the major domains, measurable progress has been made at the state level, at the federal level, and in terms of advancing nursing education. But there is still much more to be done. The steps that have been made are steps to build on, not steps to rest on. And I think, once again, this institution, importantly, can help to lead on many of the issues, and your voices all matter as advocates to continue to advance this important agenda. I also think that if you want to strengthen nursing, then clearly advancing recommendations like those that were in the IOM report is really important. But we also have to think not just about needs in our country, which that report mainly focused on, not just about advancing conditions of practice, education, and training, but how do we extend the reach of nurses really to every corner of the world that needs it, and really think with a globalized view, and nursing is clearly a global profession. And, I think as part of that, we really have to think about what can we do to ensure a better global distribution of nurses. In 2013, the WHO estimated that by 2035, the world will be short 12.9 million healthcare workers, importantly including nurses as a very large fraction of those healthcare workers and representing the vast majority of providers. I saw one statistic, I wasn't going to use it because I couldn't quite believe it, which is that while nurses represent 50% of the global healthcare workforce, nursing services actually represent 90% of services worldwide. It's striking if true, and it may well be true because of the critical role that nurses play. And the maldistribution of the healthcare workforce is really very striking. In a 2017 report, the US and Canada comprised 14% of the world's population and 10% of the global disease burden, but had 30% of the global health workforce. In contrast, sub-Saharan Africa, with 11% of the world's population and 24% of the disease burden, had only 3% of the global health workforce, including nurses. And unfortunately, given population trends, the problem will only be exacerbated, no doubt. And we know that the shortages are also being not just a reflection of population growth, which is very true, but also the out-migration of healthcare workers, nurses very much included, from developing countries to developed countries. And that is a trend that has been going on for many years and is continuing, really compromising in many ways the healthcare workforce in those countries of origin and creating an ongoing nursing brain drain. I also want to mention, probably no surprise to you, that the maldistribution of nurses is also exacerbated by intra-country disparities between urban centers and rural regions, and that is true in developing nations as well as in our own country. Significant urban-rural disparities exist, with rural areas tending to have lower levels of staffing, resulting in less access and poorer clinical outcomes. So once again, whether between countries or between communities, geography may be destiny, but it shouldn't have to be that way. And we really need to evaluate new models and policies that will address the maldistribution of nurses so we can strengthen the reach and impact of nursing around the world. And one last thing that I think we really must do successfully to answer a call to action to strengthen nursing, something that may seem simple and obvious, but requires our focused attention and hard work. And this is that we must ensure that the enormous contribution of nurses to improving health around the globe is accurately understood and appropriately respected and supported. I had a crash course in the importance of nursing back in my days as medical resident working in an intensive care unit. That was a while ago. But given the seriousness of the illnesses that we were dealing with and the complexity of the technology, it was the nurses that we relied on, that we turned to, who frankly prevented us from becoming completely overwhelmed. And without them, the work of that intensive care unit, probably would have come to a stop, and I dread to think what would have happened to the patients. That's obviously a very special circumstances, but so many of us in different ways, in different contexts, have seen and experienced the critical role of nursing. Whether providing and managing care, engaging with communities, or promoting public health, nurses really are the most important link in our healthcare system. Moreover, in many places around the world, they're often the first and sometimes the only healthcare provider that an individual will see. Truly, nurses are best able to connect, communicate, and coordinate across departments and agencies, disciplines, professional perspectives, competing priorities, and the needs and concerns of patients. Paradoxically, though, nurses are often undervalued and unable to work to their full potential. Additionally, there's a paucity of nurse leaders in key areas, so they lack the ability to directly influence policy and affect decision-making in critical ways, despite the fact that their understanding and insights and experience, in fact, position them uniquely to make a difference that would matter to our system of healthcare and to patients. So we can and must do better. As one of the great icons of modern medicine, Dr. William Osler once noted, the trained nurse has become one of the great blessings of humanity. And he said that a long time ago, but I think it's true today, and I think that people and populations around the world would certainly agree. But it's more than that nurses are a blessing of humanity, because now more than ever, humanity needs nurses. And now is the time to act on that knowledge. Now is the time to raise the status, profile, and capabilities of nursing locally and globally. Now is the time to celebrate the many contributions that nursing has made to promoting health and caring for disease since the profession's very inception. And now is the time to recognize and act on the fact that the future progress against the great challenges before us, including so many of the things I've talked about today, combating disease, creating greater health equity, and caring for the planet, as well as other challenges emerging in our healthcare landscape, will depend on the strength and full engagement of nurses. So I'm confident, with its rich tradition of education, training, research, and service here at the Yale School of Nursing, and now with the incredible vision, leadership, and energy, I might add, of Dean Kurth, that the faculty, the outstanding faculty and students here at this great institution will be at the forefront of these efforts and will help really to lead us all to the world in which we want to live, the world in which we will be able to not just survive, but to thrive. So thank you for having me here today, to giving me the time and the honor to reflect on some of these important issues. Thank you. Do you want me to?
Yeah, okay. Sweeping, sobering, eloquent, affirming. This is why we were so thrilled to have Dr. Hamburg join us today. And also just wanted to say, given how well you grasp the framework and the ethos of how nurses approach the world, I think we have to make you an honorary nurse. So. Why don't we take moments here for some questions or thoughts or ideas from the audience?
Yes.
I met you in the early 90s on an IOM committee, and very impressed, and have followed your career for a number of years, and want to thank you for your contributions. And what a nice talk. I mean, it was very uplifting and gave us a vision and a chart and a path to go. For me, I just don't know how to help the public with the image of nursing. It just seems like, I mean, I had a high school student in my office this week doing her science project who's going to be an oncologist. I'm an oncology nurse. Mm-hmm. And she had read some of my papers. And you're just sitting there going, and you don't have to change her or try to influence her about what she might be able to do in nursing. But I have it with my sister. She has 11 grandchildren. We can't get any nurses. And I know some of our faculty have nurse children, but it's challenging. It's really challenging.
Yeah, no, it's true, and I don't, really have answers, but I think it is important to get your stories out there. It's important to bring to people's, deeper awareness the role that nurses are playing in their communities, in their clinics, in their hospitals. And I think, for me, one of the things that was great about being asked to do this lecture was that it made me go back and really, number one, think about nursing as a profession, both its history, its current role, and its future. But also to recognize, wow, I mean, I probably was a little heavy on some of the history, but I was really impressed. I hadn't really understood how central nurses were in all these various roles. And my story about the ICU was absolutely true, and it was a joke amongst the medical residents that if it weren't for the nurses, we'd all be toast and the patients would be worse. But there is this sort of notion, I mean, we live in a society, I don't know enough, I haven't actually worked in clinical settings overseas or community settings enough to, really know if the perception of nursing is different. But here, we do have a medical system that is organized around doctors. And I think that's true more broadly. In fact, I will confess that one reason why I ended up becoming a physician, besides the fact that both my parents were physicians and almost everyone I knew was a doctor growing up on the Stanford campus, I took a year as an undergraduate to work at the World Health Organization, and I was going to work on a cross-cultural study of depression, the first one they had ever done. And to my astonishment, both because I didn't have any kind of degree at all, and it's a very hierarchical place, and they had a secretarial pool, I quickly became not a research assistant, but a secretary. And it was back in the days when everything had to be done on a typewriter in triplicate with a blue form that went here and a yellow form that went there, and I'd never learned to type because I never wanted to be a secretary. So that was miserable, number one. But I also realized that even in that setting, the World Health Organization, that you couldn't really sit at the table if you weren't a physician. And, I had been thinking about wanting to do something in medicine at that point, but I hadn't really shaped, my thinking entirely. But I was very struck, a physician. And that is a mindset, unfortunately, that, has organized how we think about healthcare. People, So I think we've got to break that down. We've got to help people understand who's doing the real work, and also build the case. I would point you towards a new activity that's called Nursing Now. I don't know if you're familiar with it. And in fact, I was going to suggest that your lecture next year might be done by a particular individual who I'll talk to you about, who I think is extraordinary, who's a nurse that, embodies all of the best characteristics, but also, is now an advocate for nursing around the world. But this program is really trying to put a focus on the role and needed contributions of nursing, and I think it's going to make some difference. But anyway, a long answer to say that I don't really know, but there are, especially in this country, cultural stereotypes that work against the nursing profession. I hate to say it, but I think it's true. I wasn't joking when I said, I don't think you get enough respect. But how to make that change. I'm worrying about a parallel issue in terms of how to get the public and policymakers to better understand the importance of science. Science in their lives, science-informed policy as we move forward to address big challenges. And it's the same kind of thing. Everybody loves nurses. If you poll the American people, I'm sure nurses are very high in terms of trust and appreciation. But how do we get that to translate into a broader set of needs in terms of education and training and support for the nursing profession and the appropriate role across its many dimensions? And importantly, getting more nurse leaders into critical decision-making positions. I think if Yale can make one contribution, it may be breeding that next cadre of nurse leaders who will be working in different settings, but creating a new image of nurses for the people around them, and bringing the perspective of the nursing profession to the decision-making table.
I totally agree.
Yes.
I'm a retired public health nurse and very concerned about it being an endangered species currently and forward. A treasured and historic past, but to use your words, we must build on it. And I'm very concerned about a competent generalist not being valued as much as a skilled specialist.
Well, I think that everything seems to go in cycles, and I think that what you just said was true, but I actually think that our understanding of what matters for health, how we shape a healthcare system that really matters, the recognition that not everything that matters for health happens within a clinic or a hospital setting, will reinvigorate an appreciation for the role of public health nursing, for the role of community-based programs and services. If we're going to make a real difference to improve our health status indicators in this country and improve the quality of care in this country, we have to have a different way of thinking, and it's not just those direct clinical health services, but it's also the ability to go to the community level, like the Berts Org, and link the health and medical care issues to other critical services and supports, other connections, et cetera. So I have some hope. But I think, again, this isn't a time when people can sit back, rest on laurels, or pontificate about what's needed. This is a time to get out and act. Every IOM report, I don't know if you remember this is now, I think, history, but used to begin with a quote from the poet-philosopher Goethe, which was, "Knowledge is not enough, we must do. Willing is not enough, we must act." And I always sort of find myself cycling back to that because, sometimes, especially in an academic setting, and often in a government setting, we talk a lot, but now is the time for action.
I was just going to comment back to Ruth's question and just say that there are multiple ways that the faculty even currently are reaching out to the kids, basically. Mm-hmm. So not that it's too late to work on parents, but we have faculty members that start as early as school age, working with Girl Scout troops, working with Boy Scout troops and letting them know that there are male nurses and this is what the different careers are. So we present nursing programs at a very young age through Yale, and the simulation department works with the Connecticut HOSA group, and this is the Healthcare Occupation Student Association. It's actually a national organization which is at the different high schools that presents them with all the different healthcare options. So some will specifically focus at the end that they will become certified nurses, nursing aides, nursing assistants, and take the examination. But others, they have developed their curriculum to simply expose them to medicine, nursing, physical therapy, and all of those different occupations. But they will actually come to the school and we will give them a presentation on the R-level occupation as well as advanced practice nursing, going into research, going into education, all of the different types of nurse midwifery. And because of that, we've now established relationships with multiple schools, and we've gone out to the high schools who is a little too far to come here as well. So anybody who's interested, that's my plug to say you're more than welcome to get in touch with me and I can hook you up with the system.
Well, I think that's great. And I do think, that reaching out early is great. I also, a lot of people come talk to me now about, wanting career advice, and they want to be, active in the medical field, but they don't, frankly, want to put in the time of going to medical school and residency training and all of that. But they don't think about nursing as an alternative pathway. And I think how to actually make people understand that you can have an equally dynamic and impactful career, and that you don't just have to think about being a doctor, despite what I said about the World Health Organization.
You need to work with the guidance counselors.
Yeah, because I don't think it's a pathway that, there's something sort of, I dare I say it, sort of old-fashioned in the way many people think about nursing. And I also think that maybe, I'm sure that there's a community of nursing schools, and your deans talk to each other, and faculty in different areas talk to each other, but starting to share models that may work, cross-fertilizing is also probably a good idea. I hate that we now actually live in a world where celebrity makes a difference, but you also probably need to find some celebrity nurses. I was thinking about this when I was learning about this program that I mentioned, Nursing Now, but it was actually launched by Kate Middleton. And she gave a very compelling speech about, I guess that she has a lot of nurses in her family. She's not a nurse herself, but she talked about how much she admired the profession and the difference that people made. And then her nurse midwife that had delivered her baby Charlotte happened to be in the audience, and they, found each other, and, and she talked about the power of that relationship. And I was thinking, need a few more celebrities to speak to the power and importance of nursing.
Yeah. Thank you for your talk. I want to just off of what Ginger said, there is an opportunity for systems to improve the perspective of perception of nursing. But I think we have a responsibility on an individual level, all the nurses and the nurse educators in this room, to speak positively about our profession and be proud. But also for our physician colleagues and policymakers and people who have experienced the care of nursing to also be very thoughtful about the words that we use to talk about nursing as a profession, so that we don't perpetuate this old-fashioned perception of nursing not being rigorous enough academically. And on a personal level, I attended an Ivy League institution undergraduate, was considering medical school, and observed a nurse practitioner. And I said, oh, that's actually the role I want to be in. And it wasn't about, I'm not smart enough, I don't have the tenacity to put in the time into the education. I've completed my doctorate degree, and there's value in my nursing. I consciously made that choice. Many of us have. So.
Okay.
All right.
Well, we have just a moment of a small gift to, again, thank you for taking time out of your incredibly busy schedule.
Wow, that looks beautiful. Shall I open it now?
Go ahead.
Okay.
I want to thank Michelle Koss also for helping to put together the event today, and I think everyone else who was involved. I want to
I want to thank them too.
The tea afterwards, but just to
how
share
lovely!
Yeah, so this is from
this is Planetary Health, respecting
the Earth, and it's also from a beech tree from the law school. So
really?
Nice
how
to
wonderful!
So,
Amazing.
Yeah.
Well, that's great. Well, that means a great deal to me. Well, thank you.
Thank you. We'll retire now for the winter tea. So, thank you again.
Thank you.